My name is Rebecca Lang. I'm the CEO of the Queensland Network of Alcohol and Other Drug Agencies, and the project that we worked on was to improve access to specialist AOD treatment services for people with severe and persistent mental illness. And to do that, we ran a number of networking workshops where we drew people in with a conversation about a particular harm reduction topic. And then we also developed a set of harm reduction resources for people who are on commonly prescribed mental health medications as well as regular substance users. So the project was primarily about the networking forum, so we ran 4 of those around the Brisbane North Region with both mental health and with alcohol and drug clinicians. And we also developed a suite of 132 harm reduction resources across the main drug types and against the main mental health medication types. So if you're a cannabis user who's also on an SSRI, there was a specific resource targeted at you that talked a bit about how the mental health medication was presumed to work in the body, a bit about what we know about what the illicit drug or the licit drug you were using works on the body, and then what might happen if you combine those two things, and then some tailored kind of harm reduction messaging around how you might avoid the worst possible combinations of the two substances you were using. So the third part of the project was the development of a referral resource that either people experiencing problems or mental health workers who are working with people who are experiencing problems around their alcohol and drug use could use to identify the type of service that they might like to access and what they wanted to get out of the service. And then it would produce for them a list of services in the region that were able to meet that need, along with contact details, so that it presumably would help people get into treatment earlier and identify the right type of treatment for themselves as well. They were really well attended, and we were able to demonstrate that people's knowledge and understanding of appropriate harm reduction strategies with regular drug users improved in a statistically significant way. So that was really gratifying to know that that's a proportion of the mental health workforce that is now better educated and informed about how to do harm reduction with their client group. But perhaps the referral resource and the harm reduction resources are the two parts of the project that gave it its sustainability. So the referral resource has actually now been further invested in through both Brisbane North and Brisbane South PHN, and now has been expanded out to be a statewide referral resource where people can access information about not just non-government but also public alcohol and drug services across the state. There's downloadable PDFs that now people can generate, so a worker could sit with someone and go through the referral resource and then provide them with written information to back that up. And the harm reduction resources have been universally welcomed, not just in Australia. We had a query from our cousins across the ditch asking if we were okay with them promoting the resources. Of course we said yes, and they've literally been downloaded thousands of times from the QNATA website. We also recently had an approach from the Cracks in the Ice website, which is a website developed by some academics with support from the Commonwealth Government to provide evidence-informed and practical resources and information for people who use methamphetamine and their families and carers. And now all of the amphetamine-related harm reduction resources have been linked to through the Cracks in the Ice website. So clearly the harm reduction resources and the referral resource both met a need, filled a gap that we didn't currently have, and it's been fabulous that we've been able to maintain those post the project completing. I think it's a really great legacy. So I suppose the main outcomes that the project achieved were the bringing together of the two workforces. So it's an unfortunate kind of byproduct of funded networking activities that once the funding ceases, the networking activities also cease. But we had a number of occasions during those networking forums where alcohol and drug services would form partnerships with mental health services. There was one that happened over the first 2 networking forums that has now resulted in services partnering together formally to deliver kind of integrated services to the shared client group. I hope that there's a lot more of that went on, and that's not a standalone sort of single example, but it's one that we, very rarely do we get to be there when the fruits of our labour are realised, as it were. So it was really nice to have one set of services come back and say that the networking forums had provided them with an opportunity to get to know a service they didn't already know, who was already working with the same client group. So clearly that's a good outcome for the clients of those two services. So I'd like to think that hopefully means that one of the outcomes of the project is that treatment services have become slightly more accessible, or at least that people need to call fewer services before they find one that meets their needs. And then the harm reduction resources, I mean, I think that's our biggest impact, because that says to people who are on commonly prescribed mental health meds that we're not going to judge you if you're also using substances, that we actually care about your health and your well-being, and we want to make sure that you've got the right access to the right types of information to help you make really informed choices, or at least to minimise the risks from the choices that you're making. So that, I think, is the really big win, and we'd be hoping that in the next couple of years we'll be able to find a way to fund a review of those resources, just to make sure that the science that underpins them, which is what makes them so valuable, is kept as up to date as possible. I guess what I'd love to see is that some of our national directories start to speak to the types of information that we were able to include in the directory here, which was developed, co-designed with the workforce and with some clients about what's the sort of information that you would need to have to be able to make a decision about whether calling this service was going to result in you being offered a service versus being told, no, this service is not for you. So sometimes it's really simple information, like whether a residential rehab allows people to continue smoking nicotine whilst on the premises. That's the sort of thing that if you've worked up the courage to go to rehab and you finally make the phone call, that's a thing that makes people say, no, I don't want to go. That's a bridge too far, that's too hard. And then we know that it's really important to capitalise on those moments when people want to seek help around their substance use. So anything we can do to reduce the barriers so that people get access to the right type of service sooner is going to have a good impact.